Hello, everyone. Good afternoon. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: benign prostatic hyperplasia (BPH). Benign prostatic hyperplasia, or BPH, is the non-cancerous enlargement of the prostate, usually begin in the 50s in men, and which in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and is the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events, etc., difficult. A doctor, such as a urologist, can actually treat your condition and help the patient to get some relief. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Srikanth, MD and General Surgery, MCH Urology. He has rich experience and hands-on expertise in stone management as well as in treating urological problems. He is currently practicing at TX Hospitals, Hyderabad. Dr. Srikanth has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Srikanth.
Hi, Samyukta. Thanks for the brief introduction about me. I'm happy to hear that. And hi all to the viewers.
It's a pleasure to have you with us, Doctor. And today we are talking about BPH. Now, as I have already mentioned in the beginning, BPH as it's related with prostate, which is an organ, present in males, which is quite common, this BPH, or the enlargement of prostate. First of all, we would like to understand, Doctor, what is BPH?
Yeah, BPH is actually a misnomer which is used clinically very easily, but actually we need to mention the term as BPH, that is benign prostatic hyperplasia, only after a histopathology report of the prostate, which is acquired after a surgery in these patients. So the clinical diagnosis in these patients will be like benign prostatic enlargement, BPE, okay, or a bladder outlet obstruction secondary to prostatomegaly. So prostate is a gland, as you have already mentioned, present in all males, which grows in all males according to their hormonal status, along with age. So once this prostate causes some issues, okay, well, it could be a benign enlargement or a cancerous enlargement. So when the patient comes to us, we generally segregate them based on few blood or few parameters like a CT scan or something when it is necessary, when we find that as a cancer. And once we take a biopsy of that, if we feel that it looks like a cancerous lesion, we go for a biopsy, a needle biopsy. Or if it just looks like a benign enlargement, then, depending upon the patient symptoms, if we go for a surgical option and remove his prostate endoscopically or laparoscopically or robotically, and once we send it to biopsy, then we call that as a hyperplasia, which is a pathological name for that. Okay. So as long as we don't have that diagnosis with us, we generally call it as BPE, benign prostatic enlargement, which is the most common presenting complaint because of prostate in males.
Right. And doctor, what causes BPH? I mean, is it just the age, as you said, that it's a natural process, just like graying of hairs, etc.? Is it that natural, or there are other factors responsible for it?
The most important contributing factor is age itself only. But if you talk about other factors, every male will age at some point. So according to this, every male should develop prostate enlargement, but it doesn't happen. It is mainly depends on the hormonal balance of the patient. So the prostate is a gland which is related to internal sexual organ. So it is stimulated by a hormone called as testosterone levels in the body. So the second most important contributing factor apart from age is the testosterone levels in the body and the testosterone receptors which are present on the prostate. So, and that again, it comes to the factor of genetics only. So patients who are having these receptors high in quantity, these patients will have more enlargement of prostate compared to their contemporary friends. So if you ask me an indirect evidence how we can establish this, apart from genetic tests, which patients will develop prostate enlargement and which patients will have some difficulty in their age. So the indirect factor is other effects of testosterone hormones like male pattern baldness. It is also directly related to testosterone hormone. So if a person is having baldness, it is high chance that he also will have more prostate enlargement compared to a non-bald guy. Okay, so prostate enlargement, one is age, the second is genetics, and the third is obviously unhealthy habits like high fat intake. Okay, coming through the diet, and other habits like smoking and alcohol intake will also cause enlargement in prostate. These are the main four contributory factors.
Okay, doctor. And doctor, now talking about the symptoms, what are the most common symptoms?
Yeah, if a prostate is enlarged, the patients will present with wide variety spectrum of symptoms. Every patient will not have the same complaint. Say, for example, we can segregate the prostatic issues as two categories. One is irritative symptoms, and the second one is obstructive symptoms. If the prostate is enlarged, but it is not causing obstruction to the urinary flow, but still it can cause some fun symptoms. The fun stands for abbreviation for frequency, urgency, nocturia. So we call it as the frequency is described as repeated multiple times of voiding. The patient needs to go to washroom every half an hour or hour or so. It can be worse in the night time. We call it as nocturia. If it is in the morning time, we call it as daytime frequency. And the second most common complaint is urgency. Whenever the patient gets the notion of passing urine, he immediately has to rush to the washroom. Otherwise, he will have a sensation that it may leak at any time and wet his clothes. So this is urgency. And the third common component is nocturia. These are the irritative complaints. Coming to the obstructive complaints, when the prostate grows its size, and when it comes into in the stream of urine into the urinary tract, it can cause obstruction. So the symptoms related to obstruction are intermittency. When the patient is passing urine, there will be cuts in the urine. He will stop, start, stop, start, stop. This happens. The second complaint is straining. He needs to strain to overcome that resistance in the urinary tract. His bladder has to function more, has to pump more, and he uses his abdominal muscles to strain to get that normal stream. And the other complaint is dribbling. So when the patient passes urine, in spite of stream, he will have last few drops dribbling along his urethra. So these are the obstructive symptoms. And the fourth symptom is hesitancy. Hesitancy is like once he goes to the washroom, he starts to void, but he cannot void. He waits for a time. He takes around 5 to 10 seconds for him to start. So this is hesitancy. These are obstructive symptoms. And the first earlier mentioned the fun symptoms, that is frequency, urgency, nocturia, irritative symptoms. And apart from these, other rare presentations of prostate enlargement is hematuria, that is blood in urine. A large enlarged gland will have high vascularity to maintain nutrition to that gland. So whenever the patient will catch some infection because of that stasis of urine inside the bladder, because he's unable to pass complete urine, when the infection sits on this gland, it slowly erodes the surface of the prostate and the vessels are exposed. Then the patient may have hematuria, that is blood in urine. And this complaint is also one of the spectrum from the prostate enlargement.
Okay, doctor. Now, doctor, the thing is, many a times, due to age, due to, especially in patients with diabetes and all, they do have these symptoms of frequency, urgency, nocturia. And many a times people do associate these symptoms with their aging or the fact that they have diabetes, etc. Now, when you tell them that maybe it's prostate enlargement, they'll say that no, it's not, it's just because I'm aging and I'll have to live with it. So how to tell that section of people or men that no, it's treatable, you should go consult a doctor? How important it is to spread awareness about it?
Yeah, this is exactly the issue with underdiagnosis of prostate problems in India till now, because a lot of patients will say the cause for the problem by themselves when they visit the doctor. They say that I am having a good amount of water in the night, so I am going multiple times in the night for urination. They will say I am diabetic for so and so time, because of that I am having frequent urination in the daytime. So people like these, they convey themselves the information. They get to a conclusion that because this is the cause and this is the effect, what should I do for this effect? So many a times when when somebody comes to a physician, or generally they visit physicians most oftenly because of this problem, they will be under follow-up with some diabetologist or endocrinologist. So it is the role of the physician when to identify first thing when the patient should meet a urologist. And if you talk about patient directly, whenever the symptoms I have already mentioned, yes, they may be because of diabetic neuropathy, they may be the symptoms of diabetic cystopathy, but yes, these things needs to be evaluated. So for these things, we have created guidelines. The systems are already established. Whoever male patient attending to any clinic above the age of 45 years should be evaluated for prostate enlargement and prostate cancer. This is the dictum. And this should be done yearly once for 3 consecutive years. If it is negative, then he can relax. And thereafter, the only checkup will be done for once in a decade, because prostate is a very slowly developing gland, including the cancer in prostate. So it develops very slowly. So once for 3 consecutive years, you have decided there is no prostatic enlargement or prostatic cancer in this patient, then you can chill out, and your checkup only needs to be once in 10 years. So whenever you have a symptom, whenever a male patient approaches anybody in the nearby, whoever are listening to this video, if they come with urinary complaints, they need to rule out their prostatic problem, apart from other issues like diabetes, neuropathies, UTIs, and all these things.
Okay, doctor. And when a person comes to you with these symptoms or any of it, what's the normal thing that you advise? You just go for tests, etc., or straight away go for medicines, etc.?
No, first we need to examine the patient. As I said, it could be because of some other causes also. So that we need to put all the clinical spectrum into one thing. If the patient is running fever along with the pain in the abdomen, that means a urinary tract infection is taking over the prostate enlargement, even if it is there. So once you examine the patient, check his vitals, check his temperature, take a good history of it. The main important part in the examination is a rectal examination. Okay, so we do a finger examination through the rectum to check the size of the prostate, and also the other characters in the prostate, which can help you come to a conclusion that whether it is a benign disease, whether it is a cancerous disease, whether it is an infectious disease. So once we segregate this category, then we order tests accordingly. If we feel that it is a benign prostate enlargement only, you don't have any hard nodules on the surface of the prostate, the gland architecture is normal, doesn't look like a cancerous agent, then the main issue in the prostate is examination part is very less. Even undiagnosed prostate enlargement on rectal examination still may have prostate enlargement within the urinary tract. It may not grow outside for me to examine, but it may grow inwards into the urinary tract for him to cause the symptoms. So here the patient history is the main catch in the diagnosis. Always prostate enlargement, whatever the size may be, the symptoms of the patient will catch a main diagnosis. So there is a scoring chart considered as IPSS. Everybody can check it on Google. IPSS, International Prostatic Symptom Score Chart. There will be some formulation in that. You need to just enter the value for your symptoms. Your symptoms will be graded from 0 to 5, just like a telecaller review. Okay, if you are having frequency, how many times in a day? According to it, the scoring system will be there. Urgency, again, the scoring system. All these symptoms will be summed up to some value. And there will be categorized as mild, moderate, and severe. So basing on your symptom score, your treatment decision will be taken. One thing. And second thing is, I need to establish a diagnosis. A patient may be bluffing, or a patient may have more symptoms because of urinary tract infection at that particular point of time. It may be because of prostate enlargement or some other psychological issue or an overactive bladder, which is sitting hand in hand with that problem. So I need to establish the diagnosis of prostatic enlargement. So the second investigation after clinical examination comes to me is a uroflowmetry and a ultrasound scan. Uroflowmetry is nothing but a simple test. The patient just holds his urine, fills his bladder, and once he is ordered, he passes it in a machine, which gives me a graph about his urinary flow. It will give me the maximum urinary flow that he can pass. It gives me the average urinary flow. It gives me his hesitancy time, how much time he started after command, or how much time it took for him to start his voiding after giving the command, and how long he has voided because of obstruction. And this all will be given in a graph along with the values. So with these values, I can come to an objective evidence that yes, patient is really having a problem. Some patients may be habituated with the problem for many years, and they still say, I am not having any problems. Just this ultrasound scan has shown me that my prostate is enlarged, so I came to you. If I ask him any problems, he denies for it because he's habituated for those symptoms over the past few years. So when I get a uroflowmetry in these patients, the graph will clearly show me that the average flow rate of this patient is very poor. His hesitancy is very high. He's having intermittency. The graph will have breaks in between, and his peak value, which has to be reached, must not have reached in this graph. So this is an objective evidence. Subjective evidence is me doing a PR, patient saying his history, he's giving me his IPSS score chart. But for me to show an objective evidence, I need a uroflowmetry showing that his stream is not good, adequate up to his mark. And the second thing is ultrasound scan, which shows me the size of the prostate exactly, along with its lateral enlargement or median enlargement, and how much urine he is able to hold. And after voiding, the scan will be repeated. How much urine it is left in the bladder itself without voiding because of prostatic enlargement. That is called as post-void residual urine. So if the post-void residual urine is significant, patient is having a large prostate gland, and if he's having other signs of prostate obstruction like thickened bladder wall because he's pumping against a resistance for a long time, all these are direct corroborative evidence for me to establish my diagnosis of prostate enlargement. And the fourth test and the most important test to rule out a cancer is a serum PSA. It is a simple blood test which can be done after 45 years of age in all the patients for 3 consecutive years, as I said earlier. And this rules out cancer in 96% of the population. Still, there can be a harboring cancer, but generally it is negligible. So these are the main steps and main investigations for me to come to a diagnosis.
And doctor, then what are the treatment options available?
Yeah, once the diagnosis is made and it is confirmed that it is not a cancerous lesion, it is only a age-related benign prostate enlargement. So as I earlier said, depending upon the symptoms, the decision of treatment will be taken. So even if a gland is large, normally, generally, the gland will be around some 12 to 20 grams in a normal adult. So if it starts growing, it will cause some irritative lower urinary tract symptoms in the beginning, like frequency, urgency, nocturia. So if a patient comes to me only with these symptoms, I can give him medical management. And if a patient comes to me with a report of enlargement, but he's not at all having any symptoms and I cannot prove any other abnormality apart from his normal lifestyle, there is no need for any treatment in those patients. So wakeful watching is one option with diet modification, hormone-related issues if there are any, treating them. Okay, avoiding excess fatty intake, avoiding alcohol smoking, avoiding nighttime excess water intake. With these things, we can bring him back to his normal life without any medication. Say, for example, if the gland has grown this stage and the patient is having some frequency, urgency, nocturia, like irritative symptoms, I can give him some medical therapy which can relax his prostate. So the important thing about prostate is it also forms the internal sphincter for the urinary tract, so that it is one area to hold the urine. Apart from external sphincter, which is under our control, which we can voluntarily use it when we want to hold the urine, prostate acts as a lining for the internal sphincter also. So if the patient is not having any complaints, it's fine. But if he is having these irritative complaints like frequency, urgency, unable to hold, I need to relax his sphincter. Okay. So when I give these medications, which is like an alpha blocker, his internal sphincter will be more contracting to hold and helping him hold the urine. Okay. And when he wants to void, it can help him relax the sphincter. So this is the role of medical therapy in prostate. And once the gland has overgrown this size, he's having along with irritative, he's also having obstructive symptoms like intermittency, straining, and he's having recurrent urinary tract infections. He's having stasis of urine in the urinary bladder and they are forming stones. Or if there is back pressure changes into the kidneys and his creatine renal function test is deteriorating, or the patient is having refractory hematuria, or sometimes the patient may straight away present with us with acute urinary retention. He's unable to pass the urine and the prostate has completely blocked the urinary tract. And over that urinary tract infection, back pressure changes, all these will complicate the issue. So in these cases, we need to operate the patient. So the indication for surgery along with prostatomegaly is like the gland size is large, causing him obstructive symptoms, which is not relieved with medications prior. And if it is causing secondary changes, like changes in the kidneys, changes in the bladder, forming the stones, hydronephrosis, that is swelling in the urinary tract, with all these things, we need to offer the patient a surgical treatment.
Okay, we have a question about the BPH surgery from Rohan Poonawala. His question is, how long does it usually take to recover from BPH surgery?
BPH surgery, once it is done, the recovery depends upon the type of the surgery which was also offered to the patient. The most commonly done surgery is TURP, that is transurethral resection of prostate. It is an endoscopic surgery. We go through the urinary tract, excise the prostate using a cautery, that is current energy source from inside. We'll put a urinary tube in this patient for him to recover for the initial 2 to 3 days. On the third day or so, we will generally remove the urinary tract and discharge the patient. In this, the patient can manage on his own from the day one of the surgery within the hospital itself. After the discharge, he can do his routine household work and minimal office work, but he cannot do major activity like heavy strenuous activity or sexual intercourse or long driving for long distances. All these things, generally, they need some time to rest because the epithelium which we have resected needs to be regrown. It will take some time. Okay, so initial phase of rest is only for 1 day, and rest for major activities is only for 1 to 2 weeks at the most. This is depending on the procedure TURP. If you go for least invasive procedures, there are other procedures like when we can do the same procedure with a laser. Okay, the same things holds good for the laser also. The recovery will be far better because we use energy source laser. There won't be any bleeding, so we won't be putting pipe for many more days. So the recovery and the discharge process will be even faster. And for the sexual activity, for the heavy exercises, we obviously ask the patient to take rest for 2 weeks. Apart from that, there is no other major recovery time in endoscopic surgeries done for benign cases. If it is a cancerous case, it's a different scenario. It will take some time and depends upon the stage of the disease and other parts of the patient.
Right. Now, doctor, the thing is, the symptoms that you have already mentioned in the beginning, whether it's frequency, urgency, or nocturia, these are some of the taboo topics. We don't discuss it with our people, etc. Right? People keep on suffering in silence, but they won't come up or land in front of a doctor unless and until it becomes very troublesome. Now, my question to you is because prostate is a gland where the urinary tract goes through prostate. Now, my question to you is, if a person keeps on ignoring the condition, the symptoms, he doesn't go to check with a doctor, what are the potential complications? How dangerous can it be?
Yeah, complications, yes, they are definitely difficult for the patient to be managing, though not life-threatening. I wouldn't say that it is life-dangerous situation if you ignore it, because benign diseases are very rarely known to progress to cancerous condition. Benign enlargement with age does not give any predisposition to cancerous growth in that gland. So if you delay it, you may not develop a cancer, but you may develop other conditions which will be more devastating and make you bedridden, like a urinary retention. Suddenly, if a patient and is unable to pass urine in the midnight and he cannot find a health facility and he cannot reach a health facility to put a Foley's pipe to drain that urine, we have seen patients who go into a drowsy situation. They go into renal failure, they develop AKI, acute kidney failure, and they need dialysis in these situations. Some patients may develop infection, and this infection can go back again to the kidneys and develop pyelonephritis. And again, the patient may be landing in life-devastating situation where he can go into sepsis. And these are life-threatening conditions. Apart from these minor complications, which can happen is you can form a urinary bladder stone because of the pooling of urine chronically in that thing. Thus, all the salts will come close together and they will nucleate to form a stone. Over that, the stone keeps on developing over the next few years. The patient will continue to have symptoms and he will ignore because of lack of knowledge or because of lack of health facility. And these patients will land up finally at one point where the entire urinary bladder is filled with a stone. He cannot hold the urine and he continuously passes on urine. These things generally happen with neglected elderly male population, which is still unfortunately common in India. Apart from these, the patient may develop renal failure. The patient may develop cachexia, malnutrition because of these complaints. More important thing in younger population is like desocialization. They are unable to participate in social activities because of this continuous urinary leak. Wherever they go, they will start searching for bathrooms. If they go to a mall, the first thing they will do is search for a bathroom. If they go to any family gathering, they will first search a bathroom. And they cannot stay overnight in any other family or relative's house because of these issues. They cannot expose them. They cannot get them treated. So the social life will be definitely affected, especially in males, because they are more social compared to females in our communities. And the second thing is, apart from these complications, social life, once the patient presents with the complication per se to the health sector, the recovery of the treatment will be delayed. And the recovery will be less compared to an elective case. Obviously, an elective case will have better recovery than an emergency case. So if a patient comes to me with a complete urinary tract obstruction in a retention, where I need to put some pipe, the reports will be obliterated at that time. If I do a serum PSA, which is for a cancer, it will be obviously elevated. and I need to wait again for 2 more weeks for it to settle, and I repeat that test. I confirm that there is no cancer and I have to go for the benign test. In the meanwhile, for these 2 weeks, he has to stay with the Foley's. His life will be delayed. His income will be at stop at this time. His family will be at a risk of facing all these things and taking stress. So whenever you find some urinary problem, better is to address it rather than to delay it and to see to leave it to chance rather than choice.
That's true. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yeah, take-home message is for all males. We are more neglected community. I would say you will be taking care of your family, friends, wife, mother, and all those relatives. But oneself care is also very important. Okay, whoever are above 45 years of age, get your prostate checked once in a year at least until 50. After that, you will be neglected again and you can relax. And once in a 10 years, somebody will be picking you to a health center. Even that is sufficient. For the elderly population who are staying at home, for the youngers who are taking care of them, I recommend you to just get a prostate health checkup once in a year for them to, okay, take plenty of water in the daytime, reduce the water intake after 7 o'clock in the evening. Okay, if the patient is already on some diuretics like any antihypertensive medication, try to shift them to the daytime rather than into the nighttime where they cause more urination in the night, because the issue with prostate will be worsening in the night, leaving them sleepless, and the daytime they will be restless. All these things can happen. Coming to the diet, diuretic diet also, like any kata things like grapes, okay, draksha, we call in this thing, the black one especially. So, okay, so avoid these things along with citrus fruits like nimbu and all those things. And if you are sexually active, okay, prevent yourself from sexually transmittable diseases, because once prostatitis, a part of infection in this prostate, if it catches you, it is very difficult to treat, because whatever the medication we give, it won't be penetrating this prostate gland. Prostate gland is a very healthier gland because it does not allow infection to come in. But once it catches the infection from within your urinary tract, it won't allow the drugs also to enter into it and makes the healing and treatment part very difficult. So just keep your urine flowing at least 4 to 5 times in a day. Take at least 7 to 8 glasses of water in a day. And this is all you need to keep your sexual system healthy. Thank you.
Thank you so very much, Dr. Srikanth. And it was wonderful listening to you. Thank you for this very informative session. Thank you once again.
Thank you so much for the opportunity.
Thank you, viewers, for joining us. Stay connected to our prostate well-being page, and we are also available on YouTube, Twitter, Instagram, etc. Thank you. Have a good day ahead.